Hi everyone, I am Beulah Dallas, HOD of Community Health Nursing Department, Triple College of Nursing. Today we are going to discuss about the IPHS standards of primary health center. The objectives of this session are: state the meaning of IPHS, list the objectives of IPHS, explain the staffing pattern of PHC as per IPHS standard, explain the services providing by PHC as per IPHS, explain the infrastructure required by IPHS in a primary health center. What is IPHS? It's a set of uniform standards to improve the quality of healthcare delivery system in the country. In order to provide optimal level of quality healthcare, a set of standards called Indian Public Health Standards, shortly we can call it as IPHS, were recommended for sub-center, primary health center and the community health center in India. The objectives are to provide comprehensive primary health care to the community through the primary health centers, to achieve and maintain an acceptable standard of quality of care in primary health center, to make the services more responsive and sensitive to needs of the community. The types of PHCs are, depending upon the delivery case load, the type A PHCs or with delivery load less than 20 deliveries in a month, comes under type A primary health center, and where the delivery load of 20 or more deliveries in a month, it comes under the category of type B primary health center. Let's see the manpower in type A and type B primary health center. Medical officer in type A, we need one medical officer. In type B, we need one essential, desirable, one more. The medical officer Ayush, desirable at the type A primary health center and the desirable in type B primary health center also. Accountant cum data entry operator, it is essential both in type A and the B kind of primary health center. Pharmacist also, it is very essential in both the PHC. Pharmacist Ayush, it is desirable. Nurse midwife, that is staff nurse, 3 essential in type A, desirable 1 extra staff nurse. In type B, 4 staff nurse are essential and one more is desirable. The health worker female, it is essential in both kind of primary health center. Health assistant male also, it is essential. Health assistant female or lady health visitors, each kind of primary health center, there should be one person needed. Health educator, desirable in both the primary health centers. And the lab technician, it is essential. Cold chain and vaccine logistic assistant, it is desirable in the type A, also in type B PHC. Multi-skilled group D workers, 2, it is essential in both kind of primary health center. Sanitary worker cum watchman also, 1 person is needed in both type A and type B. The services provided under the IPH standards are, the first one is medical care, that is OPD services. A total of 6 hours of OPD services, out of which 4 hours in the morning and 2 hours in the afternoon for 6 days in a week. Time schedule will vary from state to state. Minimum OPD attendance is expected to be 40 patients per doctor per day. 24 hours emergency services are appropriate management of injuries and accident, first aid, suturing of wounds, incision and drainage of abscess, stabilization of the conditions of the patients before referral, dog bite, snake bite, scorpion bite cases and other emergency conditions. Also referral services, inpatient services. In a PHC, we have 6 beds that we can able to treat the inpatient patients also. And the other services are MCH care, maternal and child health care, including family planning. So under this, we are providing antenatal care, intranatal care, postnatal care, newborn care, also the care of child according to the IMNCA guidelines. The other services are medical termination of pregnancies. It's very essential, counseling and appropriate referral for safe abortion services for those in need, health education for prevention of reproductive tract infections, sexually transmitted infections, treatment of the RTA and the STAs. Desirable or MTP using manual vacuum aspiration, management of reproductive tract infections at the primary health center. The other services promotion of safe drinking water and basic sanitation, prevention and control of locally endemic diseases, implementation of other national health programs, training, functional linkage with the subcenter. The nutrition services provided along with the support of ICDS. The essential services are diagnosis of and nutrition advice to the malnourished children, pregnant women and others. Diagnosis and management of anemia and vitamin A deficiency also. Under the school health program, screening of general health, basic medicines to take care of common ailments, immunization and deworming. These are the essential care provided through the school health program. And other records of vital events and reporting need to be maintained. Desirable activities, the mainstreaming of Ayush, selected surgical procedures at the PHC, maternal death review. The basic laboratory and diagnostic services are routine blood, urine and stool test, diagnosis of RTA and STD, sputum testing for mycobacterium, blood smear examination of malarial parasites, blood grouping and RH typing. These are the lab investigations. It's essential at the PHC. And the other tests are rapid test for pregnancy, RPR test for syphilis, rapid test kit for fecal contamination of water, estimation of chlorine level of water using orthotoluidine reagent. Desirable laboratory services includes blood cholesterol, blood sugar and ECG at the primary health center. The infrastructure, it should have its own building with outpatient department, separate areas for consultation and the examination. The ward, we have minimum 4 to 6 beds and we have a separate labor room, waiting area, minor OT or dressing room or injection room need to be there, laboratory, general store, operational theatre, it is optional. The other infrastructures are cold chain room, generator room, office room, dirty utility room for dirty linen and used items, and other include the residential accommodation, computer, lecture hall and the auditorium. Transport facilities, desirable that the PHC has ambulance facilities for transport of patients for timely and assured referral to functional first referral units in case of complications during pregnancy and childbirth. The laundry services provision of for clean linen shall be made for admitted patients. At least 5 sets of linen shall be made available. Laundry services may be available in-house or outsourced. Diet indoor patients. Nutrition and well-balanced diet shall be provided to all the inpatient department patients. Waste management guidelines for healthcare workers for waste management and infection control in primary health center are to be followed. Quality assurance, periodical skill development training of the staff need to be given. Various job responsibilities assigned to the staffs comes under the PHC. Standard treatment protocols for all the national health programs and locally common disease should be made available at the PHCs. And periodical monitoring of PHC functioning. This is important to ensure that quality is maintained and also to make changes if necessary. Internal mechanisms, record maintenance, checking and supervision, medical audit, death audit, patient satisfaction surveys for both OPD and inpatient department services. External mechanisms, monitoring through the PRA or village health sanitation and nutritional committee social audit also. Let's summarize this session. So till now we have discussed about the meaning of IPHS, objectives of IPHS, staffing pattern of PHC as per IPHS, services providing by PHC as per IPHS standard, infrastructure required by IPHS standard in PHC. Thank you for watching.